do when your son likes girly things and shuns quote-unquote boy things. A listener has that problem, that challenge, I think, is how they view it, with their 4-year-old son, who is very much into princess dresses, musicals, all that kind of stuff.
Yeah.
And so they're trying to find, and he's heading off to school next year, so like, how do we kind of, we can't send him to school in a princess dress, he'll get killed. And so they're trying to set boundaries whereby there's a safe space for him to express his preferences.
Yeah.
Our guest is Dr. Shuvo Ghosh, who is the Developmental Behavior Pediatrician with the Child Development Program at the Montreal Children's Hospital. Should they, when he goes to school, should they say something to the teachers?
I think that's not a bad idea, just so that the people who are instructing him and see him on a daily basis have an idea about what might be going on in his life and in his head. If there's a moment, if there's a story that's told, if there's an activity in school where the girls are doing one thing and the boys are doing another thing,
and he wants to go hang out with the girls,
wants to go with the girls, that they're not suddenly surprised by that and start worrying about this child. I think limits are always important for anything, and especially when you're getting to the age where a child is getting to school, and parents are preparing for that. They just have to be able to find ways for their child to, it's not just about fitting in, it's about being successful at school. And part of that is being able to make friends, part of that is being able to learn what you need to learn without feeling threatened. So those are important things as well. And sometimes what you wear or how you express yourself can play a bit of a role in that.
Okay, I want to ask you about, because you work with kids who have gender identity issues.
Yeah.
How common is that? You were saying during the break that there are more kids in Montreal than we would think.
Yeah, absolutely. And I mean, I think this whole way of rethinking what gender identity is has helped us kind of open our eyes to the numbers that are out there. Because if we're not just talking about it as a disorder, gender identity disorder, which typically we think of people who feel so uncomfortable with their own biological gender that they have to proceed on to a transition of their gender as adults. If we think about it more in terms of variance, well, there's lots of guys who, like the color pink, and there's lots of women who like the color blue, because colors are just colors. They're not necessarily gender specific. We've assigned them that way in our society, but there's other societies that have totally different rules about what colors men or women wear. So there's that.
I'm thinking a princess dress in pink, two very different things. So.
Yeah, true. But there are other cultures where men do wear the dresses or the skirts, or a kilt, and that's just how it is. So our society has been sort of shaped a certain way, and we know that preferences vary wildly. So the numbers are probably so much more significant than we would think of the disorder. So if we talk about gender variance, right now roughly we talk about somewhere around 1% to 2% of the population has gender variance.
So, and can that be dangerous for them? I mean, because society is so unwelcoming. As a parent, I'm just looking at this as a parent thinking to myself, well, actually, can you stick around for like 5 more minutes or so?
Absolutely.
Because I'm thinking, as a parent, we know that transgender kids, lesbian children, our gay sons, have a much higher rate of suicide and depression. And so we want to try and prevent that, because we love and we want to protect these people.
Absolutely.
So we'll get into that in just a second. Dr. Shuvo Ghosh is our guest, developmental behavior pediatrician at the Child Development Program, the Montreal Children's Hospital of the MUHC. CJAD time is 1:30.